COVID positive on Mother's Day. That was the worst day of my life. People were dying every hour, every day in her long-term care center. I was hung up on 6 times that day by the long-term care center, trying to find out if my mom has symptoms, if my mom is okay, is my mom going to die? To sit back and watch your mom have that kind of heartbreak and explain it to somebody with dementia and Alzheimer's. What happens to her is she's just starting to lose faith. She's starting to realize that she's only existing and no longer living.
You know, long-term care is not a mess just because of COVID. It's an abhorrent system that we've created. A lot of long-term care facilities where you might have one PSW looking after 30 or 40 people. The role of private for-profit interests completely drive down the quality of care that people get. And clearly, in the context of COVID, it's been catastrophic. I think the federal government has a really important responsibility, and I think that comes in a number of different forms. We need a strong set of standards and regulations across the entire country.
If long-term care was already a part of the Canada Health Act, would we be in this current crisis?
80% or more of the deaths during COVID-19 have been seniors living in long-term care homes. What is the plan to help our seniors? When will families know that their loved ones in long-term care homes are finally safe?
When we held a protest at St. George's this past Sunday, I had Jagmeet Singh reach out to me asking if he could join in solidarity. How did that make us feel? Somebody is listening. We have a federal party leader joining us in solidarity with the same consistent message that profits do not belong in long-term care.
Well, we want to know that seniors are guaranteed good quality care. Loved ones want to know that their parents and grandparents are cared for. And workers need a guarantee that they will have the equipment they need to stay safe and a good salary to be able to work and do their job.
Friends, thank you so much for joining us. Thank you for joining us here while we lay out our plan. I first want to take a moment to talk about how hard it has been for all of us. COVID-19 and the pandemic has been extremely difficult. But what has been heartbreaking has been the fact that this pandemic has impacted some of the most vulnerable people in our society the most. That this pandemic has impacted seniors the most. They've been those who have been most infected and those who have lost their lives. It is heartbreaking when we think about that. And to think that consecutive governments, conservative cuts brought in by Harper, continued by Justin Trudeau, have starved our long-term care system of the funding it needs. And corporate greed has been put ahead of the care of our seniors. It is outrageous and it must end. So we're putting forward a plan and a guarantee to care for our seniors. And I want to dedicate this plan to all the families I spoke to who lost loved ones. I see you and I hear you, and we want to prevent this from ever happening again. To frontline workers who have been asked to do so much with so little, I see you and I hear you. You deserve to have the equipment you need and to be paid a good salary to do the important work that you do. And to seniors who often don't have a voice, are so vulnerable, we see you and we hear you, and we are going to fight for you. This is our care guarantee. To ensure that first and foremost, we take profit out of long-term care. There is no justification for profit over people. That profit is more important than the care of some of the most vulnerable people in our society. That must end. We also need to understand that when we look at the quality of work and workers' conditions, it is directly connected to the quality of care received by seniors. So if we lift up workers, we directly lift up seniors. We know that we need national standards. What have been the best practices? What have we learned from this crisis? And how can we ensure that we put those best practices to use, that we actually care for our seniors in a way that they deserve with dignity and respect? We know that in this time, we have to realize that the Canada Health principles are principles that guide our Medicare. They should also guide our long-term care and our home care. Together, we can ensure that this never happens again. We can invest in our seniors. We can invest in long-term care and in home care following the Canada Health principles and lift up seniors. We can lift up workers, and we can make sure that our loved ones are always cared for. Families never have to worry if their loved one is in a long-term care center, whether they're getting the care they deserve. We can make sure that happens. Donc, c'était un temps difficile. C'était un temps difficile pour tout le monde. La pandémie, la COVID-19, c'était difficile. Mais ce qui brise ma cœur, c'est le fait que c'était nos aînés qui étaient les plus frappés par cette pandémie. Nos aînés les plus vulnérables étaient les plus frappés et c'est inexcusable. On sait que les conservateurs de Harper ont coupé les transferts en santé. Les libéraux de Justin Trudeau ont continué ces mêmes coupures. Et c'est infamé nos systèmes de santé en général. Et c'est inexcusable. Donc, aujourd'hui, on a un plan pour mieux soigner nos aînés dans les centres de soins de longue durée. Premièrement, il faut enlever les profits de notre système de santé en total, mais en particulier dans notre système de soins de longue durée. Il faut enlever les profits. Aussi, on faut reconnaître l'importance de suivre les mêmes principes de la loi canadienne sur la santé pour réglementer nos soins de domicile, aussi nos soins de longue durée. Aussi, on sait qu'il y a une connexion tellement claire avec le traitement des travailleurs, leurs conditions de travail et les conditions de soins pour nos aînés. C'est complètement lié. On propose d'améliorer l'accès aux congés des maladies payés. C'est essentiel comme outil pour faire face à la crise et pour mieux soigner nos aînés. En plus, on veut établir les normes nationales. Ce qui est fonctionné bien, c'est quoi les guides, les meilleures pratiques pour mieux soigner nos aînés. Je veux dédier ce plan, ces garanties aux familles qui ont perdu leurs proches, aux travailleurs de première ligne qui n'avaient pas les outils et les bons salaires de faire leur travail, et aux aînés, nos aînés, qui souvent n'ont pas une voix. Je vous entends. Je vous entends et je m'engage de se battre pour vous. Ensemble, on peut protéger nos aînés. Together, we can protect our seniors. And I want to thank you all for being here. We're going to begin with now we're going to hear from some powerful voices who have been fighting for seniors. We're going to begin with Maureen McDermott. She is a long-term care advocate and is going to share her personal experience and story with long-term care. Maureen.
Thank you so much, Jagmeet. Thank you to your party. Thank you to everyone involved putting this together today. It's a great honor to be here. I kind of wish we weren't having this conversation, that it didn't need to happen, but we absolutely do. And I just want to tell you a little bit about my journey and how it started, because it really crept up on me. I grew up with a very large family, 4 brothers, all married. I really honestly didn't think my mom's golden years would be an issue. Between all of us, we would take care of her through home care, sharing the responsibilities, and life, for whatever reason, has taken my siblings and found myself alone. Then my mother had an onset of dementia. And even that, I was kind of trying to downplay, going, it can't get that bad. And then it did. It got really bad. And I was left with no choices. We tried home care, and there simply were not any services available for us to continue. And so I had to make the most difficult decision of my life by putting her in long-term care. And I was absolutely devastated. It was the worst day of my life giving that care up. But what I needed from them was help with the things I could no longer provide. Absolutely not signing her life over to these people. And then, you know, the process of even going into the building, there was no concern for me. There didn't seem to be a huge concern for the emotional well-being of my mom in this transition. I was shuffled off to a basement to fill out paperwork about payment. And that was when it first started. And I was absolutely dumbfounded that there was no questions of personal preferences for my mother. There was no home type of care being offered there. And we adjusted, we got through it, and the frontline staff, the workers were incredible, and I started to have faith. And then the pandemic started, and COVID-19 happened, and COVID-19 got into my mom's long-term care, and she was diagnosed positive on Mother's Day. This is when it became very, very clear to us that it was profits more over caring whatsoever. They were short of PPE. People were dying daily, even hourly. In the first outbreak, there was 37 lives lost. There was a call from the owner asking for families to donate money and donate PPE. So this was obviously not being done properly, and there was no proper PPE inside. And so I reached out for help. Something was presented to the owner for an order of high quality PPE, and it was denied because it was too expensive. And that's where this fight started with me, and it is absolutely not ending until this is over. The constant fight, the denial of family going in. I was locked away from my mom for a total of 106 days, from March 25th until July 9th, which coincidentally was her 93rd birthday, was the first time I was able to see her. And that decline that happened, and her trust and her faith, even in her family, because she felt so abandoned and being locked out was... I can't even begin to tell you how that was, trying to communicate with her through a dirty window, Skype calls with lousy internet where she was just so confused. Mm-hmm. And today, here we are, and we're in the second wave, and what's changed? Not very much. And I'm literally, along with thousands of others, are held prisoner by our current Ontario provincial government. We have to get rid of the jurisdictions. We have to get long-term care as part of the Canada Health Act and get those profits out forever. Mm-hmm. I know that that is not a quick fix, but it's something that really needs to happen for myself, for my son, and for my grandchildren, and every generation that is coming up that will require long-term care. We have to get the profits out. It is not a place to be making money. We have over 3,500 seniors that are now dead in Ontario due to COVID. Mm-hmm. They will not bring in military. They will not get rid of the profits. It seems to be the focus. What also needs to happen moving forward is we've realized through this pandemic that the families' voices, which in fact are the ones that pay for this service and actually pay those shareholders for us that have families in for profit, we need a voice at that table for any legislation going forward so that we can speak for those people that are inside, that are affected by the genocide that is happening currently. We absolutely have to have meaningful pay for these staff. The staff that are in my mom's house, in my mom's home, are my angels, and they do such a fantastic job, but they're starving. They're having problems making ends meet. They don't have daycare. They take time off because of all these false positive COVID tests that are coming in, inaccurate testing, forced to be off for 10 days, not even sick, with no pay. It makes no sense. We have to take care of our staff. We have to pay them. We have to make sure that families are no longer locked away from that access from their loved ones. Mm-hmm. I can't tell you the amount of people I have talked to that they're woken up to phone calls that their parents are gone. They're looking at them through dirty windows, saying the last goodbyes to these people that are citizens of our country, that have built this country. We absolutely have to have meaningful inspections going in there. 9 homes were inspected last year in Ontario. Shame on them. It should be every single home, unannounced inspections with meaningful consequences, meaning fines and revoking of licenses. And I just want to thank you for the guarantee for our loved ones. And I just hope that the rest of the population can get behind this, because I think we all agree what's happening currently in long-term care and the thousands and thousands of beautiful souls that are no longer here could have been avoided. As I said in the video, what would it look like today if long-term care was?
Thank you so much, Maureen. I really, really appreciate your words. And thank you for sharing your story. Your personal story is very powerful, to know what it's like to have a loved one in long-term care, the decision you had to make, and how difficult it was to go through this time not knowing what was going on and not seeing that quality of care that you know your mom deserved. Maintenant, on va passer la parole à Dr. Nima Machouf. Dr. Machouf est une experte en épidémiologie et merci beaucoup d'être ici. Et je passe la parole à Dr. Machouf. Encore, je cherche si Dr. Machouf est là. Sinon, on peut retourner à Dr. Machouf. Donc, on va essayer maintenant de passer la parole an autre personnage. We're going to come back to Dr. Machouf, but in the meantime, I want to ask if Dr. Amina Jabbar is available. She is a geriatrician, someone who is an expert in the care of seniors and has been a strong voice in fighting for seniors. Is Dr. Jabbar, are you available?
I have to say I'm incredibly pleased to be joining the NDP today, specifically because this is actually on the agenda. That long-term care is something that the party has flagged as being absolutely essential to talk about. I want to echo what Maureen said. It's unfortunate that I think COVID is what took to force these conversations about what's been long-standing problems within long-term care. I think a lot about the patients that I have in long-term care. We've heard many of those stories. Maureen's mom is one of them. And now I'm starting to also think a lot about the patients that I have who are completely homebound, who need help to get to the bathroom, who need help to get changed, who need help to eat, who need help to get back into bed. And if they have families, those families are too scared to place their loved ones into long-term care. But frankly, even if they wanted to, long-term care is still so stretched to the point that they can't get placed. I still have families who have been waiting for loved ones for long-term care bed now for about 6 to 8 months.
Wow.
And in Canada, we have decades of inaction from federal governments, just unwilling to take this responsibility for people who are the most vulnerable, who have complex health issues, and who need that 24-hour care. And we have no enforceable national standards. And really, our system ultimately takes public tax dollars and privatizes the profits. That money lands into the hands of for-profit operators. It's meant that long-term care homes are severely understaffed. It's not uncommon for us to see one PSW to 30 or 40 residents. Frontline workers are incredibly underpaid for the work that they do, and the infrastructure is really outdated. And so ultimately, we've socialized all of the risk. People in long-term care, their families, frontline workers, they're the ones who have paid the highest price with dignity, isolation, and burnout. And I think if there's any possible silver lining, it's that people now understand how desperately and dramatically long-term care needs to change. The federal government needs to embrace the responsibility to phase out profits in long-term care, develop a set of regulations that ensures quality of care, and to fund long-term care at levels that older adults deserve. I think the NDP platform provides that. Thank you guys so much for putting that together.
Thank you so much, Dr. Jabbar, for being here. Doctor, your voice on this matter is incredibly powerful. And thank you for acknowledging that this has been a historic problem with long-term care that's just been exacerbated and exposed by COVID-19. We're going to continue to fight for seniors, and thank you so much for your voice. On va maintenant retourner à Dr. Nima Machouf. Comme j'ai dit, Dr. Machouf est une expert en épidémiologie et je passe la parole maintenant à Nima Machouf. Dr. Machouf, s'il vous plaît.
La pandémie de la COVID nous a montré à quel point notre système de santé était fragile, même pour un système de santé gratuit et universel. En fait, pendant les périodes de crise, c'est toujours les maillons faibles qui cassent en premier, justement parce qu'ils sont défaillants. Et de ces maillons faibles-là, dans le système de santé, on n'en a pas manqué malheureusement. Un de ces éléments était les centres d'hébergement pour personnes âgées. Partout à travers le pays, mais particulièrement au Québec, on a souffert à ce niveau-là. Il y a eu beaucoup de pertes de vie, il y a eu beaucoup de personnes qui ont souffert, beaucoup de souffrances dans ces centres-là qu'on a vécu, des personnes qui ont vécu dans des conditions inacceptables et qui ont reçu des soins inadéquats. Nous, population, peut-être qu'on n'était pas au courant de ce qui se passait dans les CHSLD, mais les gouvernements qui, l'un après l'autre, pendant des décennies, n'ont cessé de couper dans les budgets à la santé, eux, ils devaient être au courant de ce qui se passait dans les CHSLD et eux, ils devaient prévoir cette catastrophe-là. Il manquait de tout. Il manquait de matériel, il manquait de personnel, tout était désorganisé. En plus, depuis des décennies, encore une fois, une partie de ces centres-là sont confiés au privé. Mais la logique marchande, la recherche de profit, n'est pas compatible avec cette logique ou ce paradigme de santé comme droit fondamental. Alors, si on veut collectivement pouvoir assurer la santé à tout le monde, peu importe où il vit au Canada, peu importe quelle quantité de biens il possède, on doit changer ça. On ne peut pas confier ça au privé. Et c'est juste ensemble qu'on va pouvoir y arriver. Le gouvernement fédéral doit faire sa part pour s'assurer que les choses vont changer, mais c'est juste ensemble qu'on va pouvoir y arriver. Alors, je compte sur vous.
Merci, Dr. Nima Machouf, pour cette présentation. I want to thank Dr. Nima Machouf for that presentation. So we've heard from Maureen McDermott, we've heard from Dr. Amina Jabbar and Dr. Nima Machouf. And I want to make it very clear, we are in a crisis right now. On top of this pandemic, on top of COVID-19 and its impact on all of our lives, there is a specific crisis going on in long-term care. And we need to respond to that crisis with the urgence that it merits. So we've got a plan, very concrete steps for that care guarantee, immediate steps that we need to take to remove profit out of long-term care. We can start with Rivera. It is owned by a federal agency. We can immediately make that public. The federal government has the power and the ability to do so. We're going to fight and push for that to happen. We know that paid sick leave is vital. We've heard from these experts, and we've heard from many experts that say that paid sick leave is one of the most important tools to keeping people safe in this pandemic, and specifically in long-term care. So we need to make sure that at a minimum, 10 paid days of sick leave have to be accessible, flexible, easy to access, no delay. Workers need to be able to access that. We know that the condition of workers, when they have good salaries, good pay, good conditions, it immediately means that seniors are better cared for. There's a direct line. So we need to make sure that they're cared for. We know that this problem in long-term care is historic. Historically, for a long time, long-term care has been starved of funding. Home care has been starved of funding. Harper brought in cuts. Justin Trudeau continued those cuts. We need to reverse that. We need to invest in long-term care and invest in home care, but it has to follow the principles of the Canada Health Act. And in the long term, we need to ensure, so this never happens ever again, that there is no profit in our healthcare system, period, but specifically in long-term care and in home care. These are some of the key steps we can take immediately to care for our seniors. We need to respond to this crisis with the urgency that it merits, and we can do so. Donc, merci encore pour être ici avec nous. On a entendu les histoires des experts, leur expérience et leurs recommandations. On sait que c'est une crise urgente maintenant pour nos aînés dans les centres de soins de longue durée. Et on peut agir, on doit agir dès maintenant. Et qu'est-ce qu'on peut faire? Tout de suite, il faut enlever les profits dans les centres de soins de longue durée. On peut commencer tout de suite avec Rivera, qui est propriété d'une agence fédérale. On doit mieux aider nos travailleurs et travailleuses de faire leur travail. Ça veut dire plus un bon salaire, plus d'équipement et aussi de s'assurer que les travailleurs ont accès au congé de maladie payé qui est flexible, accessible, facile et rapide. C'est essentiel. Et finalement, on sait que dans ces pandémies, il faut répondre avec l'urgence de cette crise. Donc, on propose une garantie pour les familles, pour nos aînés et pour les travailleurs. Ensemble, on peut mieux soigner nos aînés si on suit les réglementations, les principes de la loi canadienne sur la santé pour nos soins de santé, pour nos soins de longue durée et pour nos soins domicile, on peut réussir. Merci beaucoup. Thank you so much for joining us. I really appreciate having all our great speakers and having you spend some time talking about something so important. You can count on us to keep on fighting for our seniors. They deserve nothing less.
Jagmeet, if you want to say a few words just for an introduction, and then we can go to questions.
Certainly. Thank you so much for being here. We just put forward our plan on the care guarantee. I know this plan has been provided to media. I'm looking forward to your questions. I believe that seniors deserve better care. Conservatives cut healthcare funding. Liberals continue that cut. It has starved long-term care for a long time. We believe in increasing that investment, lifting up seniors, protecting them, and we've got a plan to do so.
Thank you very much. So if you have a question, please use the raise hand function at the bottom of the page, and then we will unmute you to ask your question, one follow-up. Si vous avez une question, je vous inviterai d'utiliser la fonction lever la main au bas de la page, une question de suivi, et je vous donnerai le droit de parole. Alors, nous allons commencer avec Micheline Laflamme avec Radio-Canada. C'est à vous.
Bonjour, Monsieur Singh.
Bonjour.
J'aimerais vous poser une question concernant les vaccins. Comme vous savez, c'est aussi d'actualité aujourd'hui.
Oui.
Il y a plusieurs appels qui ont été lancés, puis même par les provinces, pour que le gouvernement rende public le contenu des contrats avec les fabricants. La ministre Annan a déclaré qu'il y avait des clauses de confidentialité, ce qui l'empêchait de les rendre publics. Mais est-ce qu'il y a un moyen, selon vous, pour que le gouvernement puisse faire connaître ou dévoiler justement les clauses de ces contrats?
Oui, absolument. Je pense que premièrement, c'est essentiel pour la transparence d'avoir, de savoir c'était quoi, c'est qui, c'est quoi dans le contrat. Les autres pays ont fait la même chose. On sait que les autres pays ils ont des contrats avec les mêmes compagnies, mais ils ont partagé le contenu. Donc, il n'y a aucune raison pour expliquer pourquoi le gouvernement libéral, Justin Trudeau, le gouvernement libéral ne partagent pas les contenus et pourquoi ils ont signé un accord de confidentialité où quand les autres pays n'ont pas le faire. Les gens à ce moment manquent de confiance dans le gouvernement et c'est essentiel de donner la transparence.
Pardon.
Je m'excuse, si vous pouvez répéter votre suivi, s'il vous plaît.
Pardon, oui, je l'ai mis en sourdine. compte tenu des assurances qu'essaie de fournir le premier ministre, les ministres, on n'arrête pas de dire que d'ici la fin mars, on aura les 6 millions. Est-ce que ça, vous le croyez? Est-ce que ça vous rassure?
Non. Et la raison, si vous me permettez un peu de donner le contexte, les gens étaient tellement excités par les annonces des vaccins. C'était un moment d'espoir dans un temps difficile. C'était tellement positif. Mais avec les délais, avec le manque de transparence, avec le manque de clarité, avec les messages qui changent chaque journée, ça érode la confiance du public. Et maintenant, ils ont une vague engagement, mais ils n'ont pas livré un plan pour y arriver. Ce n'est pas quelque chose concret si le gouvernement libéral ne propose pas c'est quoi les étapes pour arriver au but de vacciner toute la population ou d'avoir 6 millions de doses, de vacciner 6 millions Canadiennes. Donc ça, c'est le problème. Et c'est essentiel parce que chaque délai va dire plus les gens vont tomber malades et plus les gens vont perdre leur vie. C'est essentiel, c'est une question de vie ou mort.
Merci beaucoup. Je répète pour les journalistes, si vous avez une question, d'utiliser la fonction lever la main au bas de la page et je vous donnerai le droit de parole. If you have a question, please use the raise hand function at the bottom of the page. Next, I have Maan Al-Hamidi with Canadian Press. Please go ahead.
Hello, Mr. Singh.
Brother.
Good, thank you. I want to ask you about Statistics Canada report on jobs that were lost in January. Now, what do you think the Liberals should do to prevent further losses in February and in the coming months?
First, I want to say this is really worrisome. A lot of people lost their jobs. And as the pandemic has shown, if we look at some of the numbers and dig a bit deeper, it's women and young people that have lost jobs. They've been disproportionately impacted by this pandemic. So what we said from the beginning is we know that there are people that have suffered and there's those that have done really well in this pandemic. We know that the largest, wealthiest companies have actually increased their wealth. Richest Canadians, the 44 wealthiest billionaires, have increased their wealth by now over $62 billion. We know that companies like Amazon and Netflix and Google make massive profits, but don't pay any taxes in Canada. What we need to do is make sure that the wealthiest pay their fair share, that if you make profit in Canada, you pay taxes here. And if you made excess profits, you have to contribute a bit more. And we support people that have lost their jobs. We support small businesses in particular to keep people hired, to keep those businesses going. We know that this time has been difficult, but those who have already borne the brunt of the pain of this pandemic shouldn't be the ones that are asked to sacrifice more. They should be given help and support.
Okay, Mr. Singh, thank you very much. I just also want to ask you about your plan for long-term care homes.
Certainly.
There always like an issue with jurisdiction here because, provinces don't really, many of them actually don't really like the feds to get involved in long-term, especially the case in Quebec. They ask for a fund. They don't want to follow national standards. How do you see the future? In the future, how do you think the federal government should handle this situation?
Well, when we think about long-term care, this is something that the people that have gone through this, people who have lost their loved ones, are saying directly, we don't want to see jurisdiction as an excuse. We need action. And while we respect jurisdiction, there is no excuse for the federal government not to play a leadership role. There is clearly a lack of funding, so we need to increase funding for healthcare. But specifically, the same principles that we all agree, all provinces already agree with the Canada Health Act. It is a law that's well established. Those principles are well established. We should apply those principles to all of our healthcare, including long-term care and home care. That's something that Canadians already support. People who've lost their loved ones, who saw military come into long-term care homes to care for their seniors, to care for their loved ones, they don't want to hear excuses. They want to see action. And we can do that. We've got a plan to start with Rivera, which is right now owned by a federal agency, to make it no longer for profit, but make it not for profit, make it public. We've got the idea that across this country, we will learn a lot from this pandemic. We've learned what works and what doesn't work. And we should put that together to establish what are the standards, what are the best practices, what are the guidelines that will save lives. There is no way that we can't find a way to work together with provinces to put forward the best practices, to establish how we can care for seniors, and to move in a direction where we get rid of profit, where we immediately remove profit from long-term care. These are some of the key things that we can do.
En français, s'il vous plaît.
Donc, on respecte énormément la juridiction et les compétences des provinces. Mais les familles qui ont perdu leurs proches nous disent, vous devez agir et vous ne pouvez pas utiliser la juridiction pour ne pas agir. Donc, on peut complètement, en respectant les compétences, en respectant la juridiction, agir. Et c'est ce qu'on propose aujourd'hui. On propose de rassembler toute la connaissance pendant cette pandémie de ce qui a fonctionné. Ce qui a fonctionné pour sauver les vies et ce qui n'a pas fonctionné. Ça, c'est essentiel aussi. On sait qu'il y a beaucoup que le gouvernement fédéral peut faire dès maintenant. On a un système de congé de maladie payé, quelque chose qu'on a lutté pour atteindre, mais il y a des problèmes que les libéraux ont créés. Donc, on doit l'améliorer pour avoir mieux accès au congé de maladie payé. C'est essentiel pour les travailleurs de première ligne et pour les travailleurs en spécifiquement qui travaillent dans les centres de soins de longue durée. On peut commencer d'enlever les profits dans notre centre de soins de longue durée en commençant avec Rivera, qui est propriété d'une agence fédérale. Et pour le long terme, quelque chose qu'on doit faire, c'est d'enlever les profits. On peut travailler avec les provinces pour tout ça, mais en particulier pour enlever les profits. Il faut augmenter les financements des transferts de santé. Il faut augmenter les financements pour les soins de longue durée et les soins de domicile. Et on peut le faire en réglementant les mêmes principes de la loi canadienne sur la santé.
J'invite encore une fois les journalistes, si vous avez une question, d'utiliser la fonction lever la main au bas de la page. I'm just inviting journalists, if you have a question, to please use the raise hand function at the bottom of the page. Merci beaucoup. Donc, ceci met fin à notre conférence de presse. This concludes our press conference. Thank you very much.
Thank you. Merci.